Okay, let's just dive right into this. Welcome to this explainer. Today, we're going to unpack something that is honestly truly fascinating. When we think about advocacy and the role of national health, we usually picture massive marches, protests, or, I don't know, groundbreaking medical breakthroughs, right? But what if I told you the real, hidden architecture actually shaping our public health and policy landscapes is something entirely different? Today, we're looking at how the everyday documents we create literally build the world around us. So let's kick things off with a pretty provocative question. I want you to really think about what drives actual systemic change. If you want to shift the entire direction of a massive nationwide health initiative, or completely change the way mental health is handled in schools across the country, what is your absolute most powerful tool? Is it a passionate speech? Is it throwing a massive budget at the problem? Believe it or not, the answer is a document. Yeah, a document. Whether it's a giant strategic plan spanning hundreds of pages, or just a brief grassroots op-ed published in your local paper, the written word is the essential blueprint for action. Because think about it, without a document, there's no shared reality, there's no measurable goal, and there is definitely no accountability. So here's our roadmap for today. We'll be looking at the entire ecosystem of advocacy documentation. 1. Blueprints for national health. 2. Rescuing data for action. 3. Tools for clinical intervention. 4. Legislation and whistleblowers. And 5. The funnel of manipulation.
All right, let's jump straight into Section 1, Blueprints for National Health.
Now, these macro-level blueprints really set the gold standard. They're basically the critical North Star that aligns funding, research, and local resources across the entire country. Take a look at the 2024 National Strategy for Suicide Prevention. This isn't just a vague statement of values. It's a concrete federal action plan with 15 distinct goals covering community prevention, treatment, and surveillance. Then you've got the National Tribal Behavioral Health Agenda, which is a strategic collaborative plan tailored specifically for tribal health issues. And it even extends into the military. The Department of Defense uses a continuously updated portfolio repository to make sure their internal suicide prevention efforts perfectly match these broader national goals. The whole role of these national health blueprints is to make absolutely sure everyone is rowing in the exact same direction. And we see this mirrored in massive professional organizations, too. They use these exact same types of blueprints. For example, the International Association of Applied Psychology, or IAAP, is rolling out a new 2024 strategic plan that they literally describe as a blueprint for our future. Similarly, the American Psychological Association, the APA, is constantly gathering member input to map out highly specific advocacy and policymaking goals for 2025 and beyond. These aren't just papers sitting on a desk. They literally dictate where thousands of professionals are going to focus their energy over the next decade. Moving right along, let's hit Section 2, Rescuing Data for Action. So, while a national strategy is incredibly powerful, let's be real. Academic research can sometimes take years to slog through formal peer review. So how do advocates actually make an immediate impact? Well, they have to rescue that vital data and translate it for the general public. When psychologists want to weigh in on fast-moving current events, they often turn to op-eds. But to craft an effective one, there's a very specific formula. You have to avoid an excess of data, which, let's face it, is super hard for scientists. You have to make the message deeply personal, and you absolutely must include a clear call to action. That is how you cut through all the noise and drive an immediate community response. We also see the power of professional newsletters acting as vital communication architectures. Look at the NASW main chapter. They use their quarterly newsletter to celebrate Representative Lydia Crafts being named Social Worker of the Year. Now, this isn't just a simple pat on the back. It's highly strategic. It keeps crucial legislative goals, like addressing severe workforce shortages, highly visible and totally top of mind for the community. And to make sure nothing gets lost before it can be formally published, organizations rely heavily on abstract books. Conferences, like the ISAP Pan American Conference, take emerging research from plenaries, panels, and workshops and compile them into these books. It's a permanent, easily accessible record of cutting-edge ideas that, honestly, might otherwise just vanish into thin air after the presentation ends.
Okay, let's zoom in even further. Section 3, Tools for Clinical Intervention.
When we get down to specific clinical and educational settings, documentation gets incredibly tactical. We see this in the careful co-design of digital tools like the Coping Compass. This is a chatbot designed for young adults, and participants actually gave active feedback on the language to make sure it was truly usable. Then there's the SWEEP project, that stands for Supporting Well-Being with Everyday Experiences of Peers, which uses documented lived experiences for narrative bibliotherapy to help reduce suicidal thoughts. And look at the REDUPA model. That required the very careful creation of trainer's guides and culturally translated workbooks. In these cases, the document literally is the treatment.
A really crucial point here is that when we create these tools, especially for youth, the documentation has to protect just as much as it educates. Take the Directing Change film contest. Here, youth create short films to try and change mental health norms in their schools, but they rely on documented guardrails for safe messaging. These written guardrails are absolutely essential to ensure that the messages they're creating about mental health are effective and, most importantly, totally safe for their peers to consume.
All right, that brings us to Section 4, Legislation and Whistleblowers.
Here, we're examining a much more combative side of this architecture, because when you want to pass a law, you need paper. Large legislative packages, like the App Store Accountability Act, currently before the House Energy and Commerce Committee, they don't just happen in a vacuum. They rely on massive compilations of formal, written letters from incredibly diverse advocacy groups. Groups as varied as SAVE and Latinos for Tennessee formally submit their written support to build the documented momentum you need to actually pass legislation. Documents also act as undeniable records of accountability. Former Meta employees Casey Savage and Jason Sadison submitted formal written statements straight to the Senate Judiciary Committee. By putting their names and their testimonies on the formal record, these whistleblowers documented very serious allegations of suppressed internal research. They forced these claims out of the shadows and directly into the legislative light.
Which leads us to our final area, Section 5, the funnel of manipulation.
So, we've seen how documents can build national health strategies and protect vulnerable youth. But what happens when that exact same architecture is allegedly used to hide the truth? Let's look at this really stark contrast. On one side, we have the transparent public health architectures we just talked about. National blueprints out in the open, clear op-eds, shared abstract books. On the other side, according to the source material, we see the alleged opacity and interference of corporate entities. Specifically, the allegations point to Meta's legal teams working to suppress findings, remove sensitive inquiries, and effectively erase data.
Whistleblowers describe a pretty chilling step-by-step internal process that they call a funnel of manipulation. According to the allegations, it works like this. First, internal reports are actively edited to remove or abstract crucial information. Second, any areas of inquiry that are deemed sensitive or risky to the company are just rejected outright. And third, evidence-backed claims are intentionally soft-pedaled in finalized reports to shield the company from future regulatory blowback. Basically, the document is weaponized to hide the data.
Perhaps most alarmingly, there are allegations of direct evidence destruction. Whistleblowers reported the destruction of research recordings and notes. This deliberately ensured that vital data about platform harms only survived in the fragile, undocumented memories of the researchers themselves. Because, as we know, without the document, the truth is incredibly easy to deny.
So how do we fight back against this kind of information loss? Well, we do it by actively creating our own architectures of preservation. We create synthesis artifacts to ensure that absolutely nothing is lost. Tools like study guides provide overviews of global indicators. Tailored reports integrate really diverse, complex sources into a single, searchable document. And source summaries consolidate information so it becomes a permanent part of a shared knowledge base. Ultimately, we document to remember.
I want to leave you with this final thought. We are constantly surrounded by this invisible architecture of strategic plans, op-eds, clinical guardrails, and whistleblower reports. If these documents literally dictate our national health and shape our collective reality, we have to remain constantly vigilant. Ask yourself, what data is being actively preserved today? And, perhaps just as importantly, whose data are we allowing to be quietly erased? Thanks for joining me on this explainer. I really hope it gave you a brand new lens to view the information all around us.